I'm certainly a big fan of evidence-based outcome measures, but unfortunately, I've had long battles with the insurance industry, and frankly, if like Rupert Murdoch, they're turning to the green. They look for the money side of things. They don't, even with the greatest evidence, and we've done a number of evidentiary of outcome-based measures of looking at reducing homelessness, looking at substance use and disorder treatment, looking at sex trafficking, looking at domestic violence, and we kind of despite all of the research, and I agree with you, we do need more. We do need much more. We need metrics on everything that we do to demonstrate that it works. Okay. But that being said, there are many forces, including the insurance industry and the pharma industry and other very powerful forces, that it doesn't matter to them. It doesn't matter to them. So there's a disparity between the forces that generate the income to pay for recruitment, to pay for new programs, to pay for good outcomes, to pay for good treatments, and the payors who are much more restrictive and don't follow the data. And so, I mean, I was having a discussion the other day with Mark Vonnegut, who's a pediatrician in Quincy, and he was saying just what you said. He said, we need more data. We need to know what works, and we need to argue and fight for what works. And I said, tell it to managed care, tell it to the insurance industry, tell it to the pharma companies. They what they want, they don't necessarily that doesn't matter to them. So what matters to them, though, I think, is grassroots movements and organization. And I think that we need to be organized in various community groups and local groups, as well as regional and national groups, to really fight for redistribution and proper use of funding. And just in that line, access to care. For example, right now, we're not allowed to either see people or write prescriptions outside of Massachusetts through Mass General Brigham. I have kids that I've seen since they were in elementary school, who then go to college, who then go to graduate school, who go leave the state. They don't have a provider. I cannot continue to see them. I cannot prescribe for them. Why? Because the Federation of State Licensing Boards wants everybody to have a license. And what they've argued, although it's not based on case law, it's not based on any laws, it's based on risk and worries about liability, that the locus of care is where the patient is residing at that moment. So if one of my kids is now in, and I'll list three, Cleveland, New Orleans, St. Louis, and I've been seeing them for years, and I know them and their family, and I've helped keep them stable, I cannot see them without getting licenses in those states. And that's because the Federations of State Licensing Boards makes it very difficult. Now, I can pay for it, but you see, this is really about money, narcissism, and power, and what they want, because it's not as though Prozac is different in Montana than it is in Massachusetts. And in fact, if you look at their continuing medication medical education credits, they're not different. Their forms are not different. There's no reason. If you work for the VA or you work for the Indian Health Service, you can practice anywhere in the country, right? But if you are a practitioner in Chelsea, you can't practice in Rhode Island. You can't practice in the next state if somebody has to move, for one reason or another. And there's something wrong with that system, and that has to be changed, I think.
I appreciate this discussion so much, and thank you, Jean, for bringing up the out-of-state licensure restrictions. I think that's actually an innovation towards trying to improve our workforce, right? If we minimize the barriers, when people can actually see people, we can reach those in rural and isolated regions of the country that don't have access to any psychiatrists, to any mental health providers. And so that's an element that needs to be advocated for. I think we need to do a lot of advocacy at the federal level in parity laws. There's been a lot of, versions of parity that's come through in recent years, but it's still not enough. Many people may have insurance, but their insurance does not cover what they need, right? Having insurance is one thing, but for many people, they don't even have insurance. But like those that actually do, there's long waiting lists and they don't even get the relevant care that they need. We need to look at mental health as healthcare, and this distinction that's been created by a very structurally imposed system that looks at it differently from physical health has done a lot of harm to our society. This is all integrated, and there's no physical versus mental health. And until our policies with our insurance and healthcare payment systems look at that, we're going to be in this vicious cycle. And I really, at the beginning of my, discussion, I talked about structural racism. It is something that we have to really wrangle with as a nation, as a country, to be able to really make change. It is difficult. It feels yucky. People don't want to talk about it anymore. There are laws in states banning me talking about it. And yet, we need to really reflect and do some self-education and look at the different places in our systems whereby we can actually undo what we know, what we're being taught, our practices, our policies that are harming those from racialized communities. And it's something that really we have to face head on with courage, because I can't tell you that we're ever going to really fix the issue facing this country until we address racism head on. We can't avoid it anymore, and we're beyond time to do this.
Well, I think it's mostly all been said. Kudos to my colleagues. But I think, to distill it down is the structures that we are trying to provide care to all of our, all of the patients and all of the residents in the United States are broken. And they're going against actually what I think our ultimate goal is towards health. So be it the licensing structure, being the structural racism that exists that keeps people from accessing care. We have a very broken system, and it's very disheartening.